Congratulations on your new Dolce table. I'd like to go over some of the features with you. First, start with table length. They come in two different sizes, starting with 47 inches and up to about 57 inches for full working length from the back of the table to head of patient. Removable tub from underneath, slides easily out from left to right or right to left. Also removable, great for cleaning. Whip unit head, double high speed, low speed, scaler. These guys are activated when they're pulled out and activated by a foot pedal. So you can choose different burst sizes for cutting and debridement. Our low speed and piezoelectric scaler. All of our adjustments for each handpiece are located just below them and are visible from our chair. From intensity from our scaler and then water flow to all of our handpieces. Scalar intensity and scalar power and intensity are side by side here as well. The scaler itself will have all of its normal accessories that come with, which we'll go over piece by piece here in just a sec. Let's talk about more of the function of the up and down features and the tilt. On the top of our pedal, we have a very light touch switch to make the table go to full length or down to let's bring it all the way down to show. Not only can we get our proper working length for ergonomics, but we can also tilt our patient so we're sure that the fluids are running to a safe place and not to the back of the throat. Instrument tray, easily manipulated or moved to either side to make sure that your tools are easily accessible. And the same thing with the whip head, whether which side that you are a lefty or a righty and wherever you prefer to work, it's very easily adjusted to those sides. Then along the side of the table, you'll notice at the back something very familiar from our human dentist, Mr. Thirsty. This suction device will kick on automatically and comes more than close enough to our patient's head. The suction module, easily accessible and will turn on when you pull it out of the holster. The interchangeable tips are here and remove with just a friction tug. Monitor stand is optional. Some people choose to put their EKGs or multi-parameter monitoring mounted to this, or an LCD monitor for our x-ray viewing is also a nice touch to have here. You also notice the modular components. These are all separate pieces. So God forbid there's ever an issue with any piece of equipment, we can remove that piece of equipment and ship to have it replaced very quickly. The light comes with detachable hand pieces for autoclaving. So if we want to keep a sterile environment, these can be sterile, so if the doctor prefers to have it. The light is touchless. We should be able to turn it on and off. Dimmer switch on the back to make it lighter or darker by holding said switch, and indication by beep when we've reached the next intensity. And I'd like to talk to you about the handpiece accessories that come along with the unit. We will start with our scaler since he's closest. These scaler tips are very interchangeable and available in many different ranges or sizes for both supra and subgingival scaling. This very typical wrench that you'll find with these scalers will fit nicely over and slide just over like so. And then righty tighty, lefty loosey, we can remove that tip and replace it with another. These tips are also should be used with a proper power setting that is adjusted here. Subgingival tips will be used at a very low setting. Supergingival tips will be used at a very high setting, always with a good water flow. Long-term scaler maintenance. You'll notice the two dots at the handpiece base. You can pull and separate that handpiece at those two dots. Realize on the one side we have two very tiny O-rings on that brass pole and then one nice big fat O-ring around the bottom. Over the years, these may start to leak and not have such a really nice fit. We send plenty of replacement O-rings for the inside and outside rings to be replaced, even the head here. So you have plenty of these. A lot of times they get thrown away in unpacking. Make sure we catalog these pieces and have them available for long-term maintenance. Next, let's talk about our low speed. The low speed drill will come with two heads. They pull right off like so. Depending on the Profi tip of your choice, this one will be a lure lock, friction grip, excuse me. This one will be a hatch for pre-assembled Profi cups. These will find the groove and slide in and lock in place. Next, I'd like to introduce you to the anatomy of your high-speed drill. These are on swivel, so your hand doesn't get tired of fighting with a hose during a procedure. These are also on quick connect for easy removal, cleaning, autoclaving, or burr interchange. I would like to talk to you about maintenance of this device. Inside each drill box will come with a small plastic bag. Inside that plastic bag will be a replacement coupling, a small spring and wire, and a very strange looking piece of metal that is the wrench to take off the cap. The small spring is for poking the water holes around the drill head. Sometimes water, corrosion, hard water, if we're not very specific on the source of water we're putting in our drill, those sediments will build up, and sometimes even schmutz from our procedure will get in there as well. So it's a good practice to poke these holes out regularly for cleaning. Secondly, we have the little wrench that we talked about. If you notice, at the back of the drill are 4 grooves. That key will fit into those grooves, and we can unscrew the back cap of that drill with that key. When we remove the cap, we can pull or push out the turbine and button alike. This is 99% of your drill's anatomy. By cleaning the head and by removing it and making sure all of the sediment and schmutz is out of there, lubricating regularly, literally, which we'll talk about in just a second, but every time we use it, we should be lubricating and cleaning. And then maybe once a month removing this cap and doing a deep cleaning. It's not a bad thing to run the turbine through your ultrasonic cleaner if it is really bad. Find our grooves, nice and tight, and that is how we service the head of the drill. Pulling back the coupler, put the drill right back on. Unscrewing these guys, we'll talk about daily maintenance as well. This is what it's called, a standard 4-hole handpiece. We have 2 small, 2 large holes. We will be lubricating with our handpiece lubricant into the smallest of the largest hole. This only requires about a drop or 2 of oil after each usage. After a thorough head cleaning like we just talked about, sometimes a few extra drops of oil and leaving it upside down overnight is a good practice to make sure we're re-lubricating all the stuff we just cleaned out. Using the tip of your thumb, we're going to place it in the center of the push button head. Putting as much pressure as we can. We're going to slide our burr all the way into it, seated well, and give it a little tug to make sure that the friction grip has grabbed. Sometimes dropping or drilling into something improper will cause bending or breakage of your burr. This may make it hard for it to come out. By grabbing onto the shank or what is left with a hemostat and depressing that button as much as you can, we can sometimes get that bent burr out. If you run a high-speed drill with a bent burr, we can destroy the bearings in this head. That rubber ring is an O-ring and is very important to making sure that the water stays coming out of the device and not going back through the exhaust to the unit. So always make sure that this little rubber guy is not only on the handpiece, but in good shape. If they get beat up after a long time, they sometimes do have to be replaced. Get with us and we'll make sure that you can get the right one. And then pressing that in. This is the back side of your Dolce table. I'll first introduce the bottles. Once we have a dedicated water source, we recommend distilled water only in these. The cleaner the water you have, the longer the hand pieces and the longer the life of all of your unit. These can be accessible via a unscrewing of the bottle completely, or we can unscrew just the filler top, and using a small little pitcher or a funnel is a quick and easy way without having to unscrew the bottle. So sometimes we can, during procedures, fill up rather quickly. Next is our sewage or gray water bottle. This is what Mr. Thirsty will dump into. Main control panel. We'll have our water gauge and our inline pressures. This is how we adjust the pressure from the compressor to the hand pieces. So if we have too high of pressure at the handpiece, we will adjust this knob by pulling it out and bringing the dial down for less pressure to the handpiece. Same thing or vice versa on the other way. By raising that number, we will bring the pressure up to the handpieces. Water regulator, the same. If we have too much pressure, too much water spraying from our handpieces, we will regulate that pressure by bringing it down here with this dial. Pulling it out, adjusting, pushing it in to lock it in. Next we have air in and air out. By pressurizing the system, putting air in the bottles after we filled it. This is how we pressurize the bottles so they are delivering water properly to the handpiece. If we want to fill those bottles without a loud rush of air and a scare, we want to release the pressure from those bottles before we do so. Down below, this is a power module. You'll also notice the color codes. The color codes are specific to the table's function, whether lift, tilt, suction. We have them categorized so we can help you in a remote situation find out what the problem is and get it diagnosed quickly. Besides the back panel, we'll have two more power buttons. One here for the compressors on and off, and one here for the main power module. Here's your compressor pressure. These will be displayed in horsepower. We generally will have these set for you during setup so you don't have to mess with. I would like to talk about maintenance. This is your exhaust or scavenge line from the compressor. By turning this dial, we will evacuate any moisture that's in the compressor for a little bit. This should be done once a month, every couple of weeks, and literally the only maintenance this oil-free compressor needs. The technique used for scaling is called the modified pen grasp. Just like writing a letter to your grandma, we want to have our hands splayed out like so. This makes sure that we can provide adequate pressure in the right places. The scaler itself provides a lot of heat at the tip, so we never ever want to use its tip on anything. We have many other working surfaces on this scaler tip and blade that we have many other options other than the tip. The only time the tip should be used or can be used is directly on calculus to try to disrupt it. Otherwise, we were going to use the side of the blade and use small sweeping motions, making sure that we have the proper power, which is adjusted here. And we want a nice spray of aerosol like so. This is going to make sure that not only are we irrigating the debris from the sulcus space while we are scaling, but it's also going to make sure we're keeping that tip as cool as possible while it's generating all that heat. The same technique is used for our low-speed drill. Take mind, that is a rubber cup. It is moving at a high RPM. When we place a composite or a pumice or something in here that also has grit, we are then spinning that at a high RPM. We can push to splay that cup out so we can get below the gum line in places, but we don't want to spend a lot of time. Notice that I am going on and off with the switch, and I am not burning out in one area for a long period of time. Not only can we cause smoke like you just saw, but we can also tear up our tips, and more importantly, we can actually damage or kill a tooth by having too much pressure, too much heat, all of those things. So small intermittent bursts with your polisher, and make sure we irrigate well. Same modifying pen grasp, so we can use structures nearby and even the patient to secure ourselves for easy, small movements. The object is to be able to extend or retract our fingertips to get the small movements we're looking for. For bone debridement, we're going to use a back and forth action and little small circles, almost like the grain of rice, to slowly remove bone. When we are sectioning a tooth, we want to keep that high RPM going at all times. So by small woodpecker ticks, we're going to always keep this drill moving. We're not going to push and let pressure do the work. That will ruin your high-speed turbine over time. By using small little pecks like a woodpecker motion, we're going to be able to get through this tooth without putting too much stress and pressure on our turbine head. Also take notice the amount of water flow. That's also super important, not only to remove all of the excess in between and debridement, but also to make sure that that drill is as cool as it can be so we are not hurting nearby bone structures. Let's quickly review the maintenance of your table. Once monthly, release the exhaust gas to remove moisture from the reservoir in the compressor. For handpiece maintenance, use distilled water only in the bottle to prevent hard water buildup. Clean the handpieces regularly by poking the provided wire into the water holes on the high-speed handpiece to remove any buildup there. And don't forget to lubricate the high-speed handpiece into the smaller of the larger holes after each use. If you have any questions, feel free to reach out to us by phone or through our website. Thank you.